You may have swelling in your legs or your arms, but what if they are starting to get hard and stiff as well? Is your skin thickening? Or have you had swelling for a long period of time? Because if you have, you may be at risk for this happening. As a certified lymphedema therapist and physical therapist for over a decade, I see this routinely, and there is a name for it. It's called fibrosis. What exactly is fibrosis, and more importantly, how do we avoid getting it if you have swelling or lymphedema? Well, we're going to talk about it in this video, so follow along. So you are diagnosed with lymphedema or chronic swelling, and now you're dealing with swelling and stiffness in your arm or your leg. It's really tough, but there are ways to manage it and help address and reduce this hardening, thickening, fibrotic tissue. Fibrosis, or that buildup of thick tissue, is really important to address because it can cause a spiral effect with lymphedema. Increase in lymphedema or worsening lymphedema causes more fibrosis causes worsening of lymphedema, and so on and so forth. So we want to make sure that we're addressing fibrosis along with the swelling too. And how do we do this? Well, let's dive into some of these treatment options. So first, let's talk about manual techniques or hands-on techniques. Lymphatic drainage is commonly used to help reduce lymphedema by moving fluid out of a congested area. It's generally really light and soft technique, but in my professional opinion, lymphatic drainage alone is not enough to soften fibrosis. So while doing lymphatic drainage, when I'm using it, I like to then add on other hands-on techniques to help break up any fibrosis that I may feel to soften that tissue. So when I describe it, I try to say it's like gently kneading dough to move and mobilize this tissue around, and also to remain comfortable as a way to break up that thickened tissue. So as we're moving along, I might feel some fibrosis, and then spending even 2 to 5 minutes in an area softening that fibrosis, gently kneading the dough, and then moving on. This can significantly improve or reduce that hardening or thickening. Some therapists may also use various tools along with their hands to help soften the fibrosis. So some examples are cups, which can help pick up that tissue that might be really bound down or hard to pick up because it's so thick and our hand just can't do it. It also helps add blood flow to the area. Another might be 𝐼Stim or instrument-assisted soft tissue mobilization. Now, these tools can be a bit more intensive, so it's important to avoid use on open or unhealthy tissue and only use when by someone who's been trained to use them. Other tools that may be used are low-level laser, massage rollers, and more. But overall, hands-on and manual techniques are really a vital component of managing fibrosis. Compression is another important treatment to reduce and prevent that fibrosis. Compression bandaging is done with the short stretch bandages to reduce that swelling or the edema volumes. These are pretty standard with the use in lymphedema therapy. But this part of the treatment is really crucial to help soften the fibrosis as well. So complete decongestive therapy, or CDT, with or without fibrosis should include various foams and paddings under the bandages to help reduce the fluid. But these layers that we choose with foams and paddings add more comfort, but they also can make a big difference for someone who has fibrosis or more stubborn or severe swelling as well. And there are a few different kinds or types. So one would be using something like Mobiderm. This is 2Ann's Mobiderm. They have different chipped foam pieces inside, and this is a roll. You can roll up a leg or arm and then use the bandages over the top, and the chip foam will gently dig in and help soften the fibrosis while you're bandaged. Someone can also use channeled foam, again wrapping a leg or arm and bandaging over the top. Same thing, the foam will help soften. And then there's some that are very similar but made as garments. So Juzo has a soft compress. They have a roll like the Mobiderm that someone can roll up the arm or leg. They also have more garment styles to slide your foot or your arm in, and has Velcro pieces to hold in place, and then same thing, wrapping over the top there. Someone can also use a nighttime garment, whatever they might already have. This is a off-the-shelf tribute wrap by L&R. They also have custom night wraps as well, or tributes, and they also have that chipped foam that these someone typically doesn't need to wrap over the top if they're custom, or they can be tightened, but that chipped foam can dig in and also, again, soften fibrosis over time. Or L&R also has their swell spot line. This is a thigh piece. This goes on the inner thigh and wraps around the thigh. And you can insert these if someone has a localized pocket of fibrosis in an area. Again, use it as a piece of the layering against the skin if able, and then wrapping over the top again to help soften that tissue over time. So there are a lot of different options out there, but you can see the general idea is to find something that has that chipped foam or more layering or thickness to it, and then giving compression around that over time. That can really help soften fibrosis. Someone can do that short term for a few weeks, or someone might have that in their daily routine, like the nighttime garment, that they're doing that every night just to make sure to prevent that buildup of fibrosis coming back. So next, let's talk about exercise. Exercise will help activate the muscles in the body to pump the fluid through. This will allow the lymphatic system to move as much as possible naturally. Along with this, fibrosis can also affect muscles in the body, which can lead to weakness or tightness, or we call it atrophy. Exercise will also provide forces in the body that can maintain and also increase muscle strength, elasticity, and overall muscle health. In some cases, when lymphedema is really severe, surgery might be an option. A liposuction is one type of surgery where doctors remove extra fat and fibrous tissue from that swollen area. Another surgery called lymphovenous anastomosis, or LVA, creates new pathways for fluid to drain, helping to reduce swelling as well. Liposuction is often used as the ideal and quick way to help remove excess fibrous tissue or fat tissue, while the LVA is used to get lymph fluid moving. Some patients may have both surgeries, but it's always best to be assessed by a surgeon for personalized decisions. Managing fibrosis and lymphedema means trying out different treatments to see what works best for you. By combining therapies like manual techniques, compression, exercise, surgery, and others, we can help you feel better and get you back to doing the things that you love to do. Otherwise, I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.